Welcome to today's webinar. The topic for today is Exploring Safety Innovations for Senior Care Organizations. My name is Megan Klein, and I will facilitate our meeting. Please note, the information contained in this presentation is intended to provide general information, but not advice about certain regulations and initiatives. This is not intended as legal or other advice, and each situation may vary depending on the particular facts and circumstances. You should not act upon this information without first consulting qualified legal counsel. This webinar will be recorded. Today's webinar will be presented by Liz Jensen and Justin Smith. Liz is the Clinical Director of Direct Supply's Innovation and Technology Center. Her career as a nurse executive, educator, and gerontological nurse spans 30 years with a focus on developing clinical leaders in the post-acute and senior care profession. In her current role, she works with senior care providers, product managers, and engineers to translate evidence-based research, regulations, and risk management strategies into practical processes, products, technology, and applications for clinicians and frontline care providers in senior care. Liz leads the Direct Supply Spark Collective Clinical, an interprofessional collaboration of senior care nurses, therapists, physicians, pharmacists, and others who test and pilot new products and services that improve outcomes for seniors and elevate quality and efficiency of care delivery to a new level. Liz has a BSN from Creighton University, MSN from Cardinal Stritch University, and is currently pursuing a doctoral degree in leadership with a research focus on reducing barriers in innovation advancements in senior care. Justin is an engineer and innovation technology manager at the Direct Supply Innovation and Technology Center. Justin started his career in product development at GE Healthcare, working in design, usability, and validation of new medical devices. Justin leads the Innovation and Advanced Technologies program, including a focus on emerging healthcare tech, including medical IoT, AI, computer vision, and voice control applications within the industry. He also works with technology startups across the U.S. and overseas to develop and test their products and move them to alpha and beta pilots within healthcare customers. Justin holds a Bachelor's of Science in Electrical and Computer Engineering from Marquette University. And now, please welcome Liz and Justin.
Thank you so much, Megan. We so appreciate the warm welcome and welcome to everyone who's joining us today for this webinar. Justin and I are happy to be here, and I think that we've all been going through so much recently in the last few months, and the crisis that has been COVID has really generated a lot of new focus for us. And I think with crisis can cause both chaos and clarity, which we know. And this pandemic has been a crisis of magnitude that most of us have never seen or experienced before. Justin and I work for Direct Supply, specifically with our Direct Supply Innovation and Technology Center. And back in January and February, we were devastated to see the impact that this virus was having on older adults around the world. And our worst fears became a reality when COVID-19 began spreading across the U.S., taking a massive toll on the people who live and work for the senior care centers that we serve. So although we had been working on safety-related projects for some time, we quickly shifted our focus to the rapid identification and deployment of innovations that would significantly help senior care providers battle the virus. And together with our providers and our customers we serve, we've been exploring new territory in innovative solutions. The vetting process we've built over the last few years continues to be tested and improved to find meaningful innovations that work for senior care settings. Justin, we can go to the next slide, please. So our focus today is really twofold. One is to share some insights into the vetting process that we've developed that is helping us quickly identify the most promising ideas for the biggest problems. And two, to share some of those ideas, specifically related to technology and products that we are finding that are most promising to improve safety, and the reasons why. So to kick us off kind of for the day today, and we thought to kind of set the stage, I'd love to turn it over to Justin here for a little bit, just to share a little bit of information about our Innovation and Technology Center.
Yeah, so thanks for joining us. As Liz mentioned, I mean, we really work together with our customers to ultimately put a focus on new solutions, to understand where the gaps in the market are, what the problems that our customers are facing, and then ultimately kind of bring the right solutions to market through testing and everything else. And so we spend a lot of our time at our Technology Center, which is a facility that we opened in downtown Milwaukee. And it really gives us the ability to bring all of these different groups together. So we have university and research partnerships that we take advantage of to understand, what is the latest and greatest that is still being worked on, and it's not even ready for the mainstream yet, but to understand kind of what capabilities are there. We also work with, startups, and this number is even out of date, and it seems like every time I give this presentation, it's out of date. But I think we're something over 2,500 different startups that we've vetted at this point over the last 5 to 6 years. We actively work with a little over 24, and we have 3 that are actually headquartered within this space as well. So it allows us to touch innovation from a bunch of different angles and work with everybody from the napkin sketch startup to the large technology company that's hoping to help out with some of the problems that we're seeing within the industry. This is our space, and I just like to show a picture to kind of get a visual behind it. And we're super proud because we actually got the 2020 Coolest Office in Milwaukee award. But the space is really meant to be an idea generation spot. So we took a building from the 1890s and brought it back, and we have different spaces set up throughout that we can bring customers in, we can bring potential end users in. Folks from the community, there's a lot that we do that's also just the educational side. So both educating our customers on what they should be prepared for, as well as just educating the community at large over these are the problems that are facing the industry, and these are the problems that we could use help in solving.
Yeah, thanks, Justin. You can go to the next slide. We use the word innovation a lot. We hear that a lot, but we're not often clear on what that actually means. And that's why we wanted to spend a little bit of time up front talking about how we're vetting innovation. When we think of something being innovative, we always are asking ourselves, is there a problem that this innovation is seeking to solve? Or is this new innovative thing looking for a problem to solve? And we know we want something different or better, but we also know for sure that the path from idea to adoption is not clear. It's not linear, and it's often maze-like. This is a quote from our director of our Innovation Center. And I really like this last thought around how much listening has to go into anything that's new that we're going to be creating and designing. And so we're always really needing to listen and understand how this would potentially be utilized, and all within the context of the settings that we serve, which is congregate senior living, skilled nursing, and rehab centers. Justin, we can go to the next slide. So on this screen here, you'll see this image of human-centric systems framework, and this is really the framework that we use that informs the work that we're doing. So we know that innovation can be cool, it can be attractive and enticing, but in order for it to really make a difference, it has to be able to close the gaps between what is possible and what is reality. It needs to get the job done better, more efficiently, and ideally more elegantly than we were doing the job before. And those who are designing, implementing, and adopting something innovative really need help to draw the map of how that looks and how the end users are really going to be utilizing it. And that guidance from those who are walking the journey and doing the work today is really critical. So as we look at how these questions that What problems is the innovation seeking to solve, and how are we really thinking about it through the lens of is there a significant and a reliable impact on improving resident outcomes, for instance? Does it generate staff satisfaction and efficiencies? Does it reduce operational costs and risks? Or could it potentially create some new revenue? So there's a lot of different things, and depending on the angle and the perspective that we have to take, but often all of these things are intertwining with each other around the resident and around the caregivers that work in our communities. And so we need to understand very well the barriers to purchasing and implementing, and whether or not those barriers can be overcome within reason. So the gap between what's possible today and where we are today is quite large. And so without some type of a more of a organized framework to keep us focused on the right things, it can become very easy for us to just really see all the cool stuff out here and be interested in the cool stuff, but not really making any substantial difference in what it actually means for senior care. So this really grounds us, this kind of thinking grounds us. And I like to share that, and we often share, if you've been to our Innovation Center, we talk a lot about this, but this is really critical in grounding into why we do what we do. Justin, we can go on to the next slide, if you like. So as we look at the next, as these next layers then of how we're seeking input from those closest to the problem, Megan mentioned our Spark Collective Clinical that we run, and we're, as part of our investigative process, one of the parts that's really critical is if a new solution is claiming a claim, are those claims supported by valid evidence? And now more than ever, I think we're researching and we're learning and we're looking at data and we're taking in information so quickly right now around COVID that we're having to do all of this concurrently at the same time to say, are the claims there yet? And because we need the innovation, we need the solution to work for us, are the claims there at a level that we're satisfied with? And normally the bar is really, really high. We need a lot of evidence to say, yeah, over the top, we got it. But we're at a place right now in the midst of this pandemic where these solutions, some of these solutions are so promising, but the research hasn't quite caught up with all of it. That do we wait till the research gets there, or do we go ahead and try it anyway? And so we've got a number of our providers that we serve that are really working closely with us to say, all right, we're willing to give it a go, or let's give this a try because we need to learn as we go. And that's really critical in helping us make sure that we're advancing the things that mean the most and that are have the potential to make the greatest impact quicker. The second bullet where we talk about, does it delight the user and ease and effort? And, you know, as a nurse, this is a very marketing kind of a phrase, right? When I hear this, I'm like, but as I've worked with designers and developers over the years, I've learned that, you know, there's a beauty and an elegance that comes in something that's really well designed. And you probably don't have to go any further than looking at, you know, the phone in your pocket and your smartphone to recognize the elegance of good design, and understanding that when things work well and they're well designed and they're thoughtfully designed for the end user in mind, that it makes the job that they're doing easier, more efficient, more effective, and creates more job satisfaction than as a result of it. We've certainly seen that in some of the things that have been implemented over the last few years, and as technology continues to improve, how we're really seeing the beauty of that elegant design, creating efficiencies for staff and creating that stickiness where they want to use it, that it doesn't feel burdensome for them to use. And that's really critical in helping people feel confident and satisfied in their job. The third bullet is the total cost within reach. And we're always looking at not only the cost of what this thing will be, but what's the total cost of it. And is it within reach? Are there different ways that we can perhaps help somebody come into owning it or purchasing it, or whatever it might be in that framework that helps them get to the place that they want to get to quicker? And the last question here, does it change how your potential customers see you? That is something that I think, as we talk to a number of providers across the country that are really thinking about that, like how do we create these environments that are safe, that people feel confident in coming to admit their mom or their dad, their grandparents to come to work, to send their loved one to work at your community. Is it a place that people feel good about coming to? And I think this pandemic has really highlighted the need for that, that thought process to be really front and center in our minds, because we need those things to happen in order to be able to continue to keep our census where it needs to be, and in order to be able to continue to serve the residents that you're seeking to serve. And so then, that last part of really that vetting process then is where we really start digging into the barriers and understanding, is it funding, or do we need more investment dollars to be able to advance this thought process or this new tech or new product? Is it staffing resources? Will this thing, whatever it is, require more people to be able to, implement it and utilize it? Or is it reducing the number of people that it needs? Are there competing priorities? I don't think in all the years I've worked in long-term care that we've never not had that every year, where we're thinking about, what are we going to be investing in the coming year? What do we have the dollars for today? This pandemic has forced us to have to rethink all of that. And, do we have the time? Do we have Wi-Fi? Sometimes that's just, the basics of it all. And those things that have to go into our thought in our consideration when we're vetting. Justin, we can go to the next slide. So as we move through this vetting process, it becomes really important that we're using frameworks that others understand, that are research-based, evidence-based. One of the frameworks that we've been utilizing, even pre-pandemic, is one that it's part of the patient safety framework. The Institute for Healthcare Improvement has had this framework in place for a while, where healthcare centers can really look at this to understand how are we thinking about building what they refer to as safety defenses. And those safety defenses have different elements to the defenses that we've really, in order to be able to make significant or impactful change, we have to understand what are those different elements that make up those safety defenses, and how do we accommodate for that when we're both designing something new or working with startup companies that are designing something new, the counsel we give back to them, and then as we're looking to implement those at a community level, helping providers figure out how to walk that and take that journey to get those implemented. You'll see here in the first column on this where it talks about the sources of threats to patient safety in healthcare organizations, again, as defined by the Institute for Healthcare Improvement. But these buckets are really critical for us to understand where we're putting our time and effort. And the two that we know here at, in our Innovation Center that we have the biggest chance to impact on our end are the two that are right in the middle here. And, we really are trying to focus on the areas where we believe that we have the talent, the resources, and the expertise to impact, and maximizing the capability of the workforce and designing work and workspaces to reduce error are those areas where we believe we can best impact. So this is, again, just provide some framework and some thoughtfulness to the work that we're doing, and grounds us in knowing that we're kind of pointing in the right direction. We can go to the next slide, Justin. So as an example, prior to the pandemic, we were working on a project around, we had named it the Falls Action Research Project. So this was something we were developing and are still developing in concert with our providers and our customers. And this, again, using that very human-centric systems framework, we started to map out what we felt was the resident journey from the time they move into a community till the time they leave, and understanding where their highest risk for falls were occurring. And the question that's rooting our work in this is, can we change the system in ways that will reliably and affordably reduce the human suffering and cost of falls? So it's a big, hairy question, but it's something that's really critical because it's helping us to understand how those systems around the resident, staff, and the environment work today. And we're learning a lot from this. So this is a picture from a design thinking session that we did with some customer groups to understand where we were identifying gaps and uncovering gaps. And Justin, we can go to the next slide, please. So as we look at as we started to pull out the staff, what we call the jobs to be done, what are the staff doing in the course of this process? And so we looked at all those intended processes and the outcomes that the systems were supposed to or hope to achieve, and understanding how those jobs to be done with help from our providers give us insight into the problem at a very level critical to affect that change. So then we started to look at the emerging or existing technologies. Justin, if you want to click just one more time. As we're looking at some of the key aspects here along that journey, we started to see where there's elements of assessment and monitoring that really are necessary and critical at every point of the resident's journey in their life in the community. And so we started to look at emerging or existing technology, products, or people who are seeking to change one or more parts of the system. And so as we're looking at that, we then start to uncover, okay, well, here is where we really start to see some impact. And so just as an example, and Justin, we can go to the next slide. This is one example of a solution. You'll get to hear a little bit more about this in a bit, but this is an example of a solution that we looked at that said, okay, this is really helping us fill in some of those gaps around monitoring and assessment that we didn't have in place before. And so by utilizing that journey map, we're learning not only what's happening to the resident, but also what's happening to the staff in the course of that. And this particular product was hitting on all four of those areas where we felt were really critical as we're vetting from a vetting perspective around resident, staff, cost, and census. And so it's just an example of how we were thinking about safety innovations before the pandemic hit. We can go to the next slide, Justin. So then COVID called, right? COVID-19 called. And on the slide here, you'll see this is just a snapshot of the number of new guidance changes, regulation changes, blanket waivers, changes that providers were engaging in and having to deal with. It's been like drinking from a fire hose and then some, where it's just been overwhelming. And so as we saw all of this volume of change happening, Justin, if you want to click one more time, we really said, we've understood that this pandemic was really changing the way that we needed to think about innovation, and that we really needed to start to shift our focus into what were the things that maybe we had looked at before and or thought about before, but there really wasn't a place or time for it. What's new or what was emerging, and really had to shift and think about how we upped our game when it comes to addressing COVID-19. And so for that, I'm going to turn it, actually, I did want to just talk about this real quick. Justin, if you want to go to the next slide, sorry. I forgot, this is where we were.
You got one more.
One more, I got one more slide before I turn it over to you. So we were talking about the frameworks earlier and why they're so important. And so when we look at the framework that seems to be rooting a lot of our thinking during the midst of this pandemic is the hierarchy of controls that the CDC and NIOSH have out, and it's been out for a number of years. But this hierarchy has been really helpful in helping to define and help us understand where there's gaps that we could go after to be able to bring new solutions and new innovation into this space. So for those that might be not as familiar with the hierarchy, we'll talk through just a little bit. So the top of the hierarchy are the most effective controls to addressing the hazard, which in this case is COVID-19. So now this could also be other communicable diseases, other things, other hazards that we might be thinking about, but in this instance, COVID-19. And so, so the elimination is the most effective way to do that. And currently right now, Justin, if you want to click once, is just as we're physically removing the hazard, is our best tool right now is isolation, and has been isolation to keep people separated from each other, keep people who are sick away from others. And so, so the more we can do that, the more we're able to eliminate the hazard. The next is substitution, and this is where that next level of replacing the hazard. And the tool we currently have at our disposal is social distancing. And so if you can't isolate, that we're keeping our distance from each other. The third is engineering controls. There's a lot here within engineering controls, and this is really how we can help to isolate people from the hazard itself through using certain types of engineering controls. And so we're seeing providers that are have utilized physical barriers. We've seen, plexiglass go up in lots of different places, the grocery stores and all sorts of different areas where we're creating these physical barriers to keep people separate. We're also seeing a lot of work done in air handling and a lot of effort around how do we make the air cleaner, how do we kill organisms that are in the air. And so there's been a lot of effort around engineering controls that we're seeing there. Administrative controls gets us to that next level, which is really changing the way that people work. And during the midst of this pandemic, there's been an extreme emphasis around hand hygiene, around screening people before they come to work, or visitors, or wherever we're going, and then cleaning practices and protocols. And so those administrative controls become very critical. The final defense, and ultimately the least effective, but our final defense is protecting the workers with personal protective equipment. And so in this case, it's face masks and gloves and eye protection and respirators. And we've really had to see the full gamut of PPE come to bear during the midst of this particular pandemic. And so as a hierarchy then, this helps us with understanding where we currently have solutions, where we don't, and where we need to really be investing time and effort to see how far up the hierarchy we can get. That takes the burden off of the individual and the human at the bottom of it to make the right decision at any given moment in time. We've heard about providers who have identified, we've also heard from surveyors that have identified infection control gaps in practice where people aren't donning and doffing PPE correctly, for instance, and having to put another human, in place to be able to monitor for that. Those very labor-intensive sorts of things that happen at the bottom of that hierarchy. And so the further up we can get, and the more we can utilize technology, the more we can utilize engineering and design practices, with the more the burden we take off of the human to have to remember to do all those steps correctly. Okay, so Justin, I'm going to turn over to Justin here a little bit, and I'm going to let him talk for a while because everybody's had to listen to me now for a while. I'm turn it over to him.
Thanks, Liz. I was looking for a nice transition slide earlier today, and I was telling Liz prior to the call, this one just reminds me of the scene from Raiders of the Lost Ark when they're all standing on top of the mountain. But I think when COVID hit and ultimately we saw what the impact of this was going to be, not just on, the industry, but kind of the whole world, we started taking some of these processes that we had started to put in place when we were looking at the Falls project and looking at other things and saying, all right, how can we fast track some of this stuff? So how can we respond and help in the hierarchy of controls and everywhere else to do our part to kind of help the industry, really kind of survive everything that was being thrown at it. So, ultimately, it's this whole idea of a landscape change requires behavior change. And I think, as no probably big surprise to anyone here, behavior change is basically the toughest thing that you can do. So we talk about all of these changes we can make of providing technology, providing supplies, and all those types of things. But ultimately, the behavioral change is the thing that makes them truly kind of come to fruition. And so if we look at it, in January of this year, we were focusing on totally different problems. Infection control was certainly something that the industry thought of, but it honestly wasn't a huge impact. We saw it when we looked at seasonal flu and things like that, but it was really seen as this kind of seasonal issue that we had to deal with. Well, March came, and obviously that viewpoint changed. And so what we ultimately did is we said, falls was certainly a big problem for the industry, but now falls has dropped down on the list. It's still a problem. It's likely still a growing problem. But all of a sudden there was this real push that we have to do everything we can to support all of these other new problem sets that are coming up. And so the thing we had to do is we ultimately had to go understand these evolving customer needs. And what impact that had on the way we work with our customers were things like, I'll say a massive increase in customer communications. I can speak somewhat secondhand of working with Liz through the beginning of this when we were starting to learn all this information and guidance was changing every day, and probably multiple times a day. New facts were coming out all the time. And we were trying to stay on top of that. We were trying to understand, all right, like what is the latest we know? What are the effective mechanisms that we can start putting in place to offset some of the risk? And so we ultimately said internally, all right, we're going to do some rapid response teams. We're going to focus on different problem sets that our customers are ultimately having and that we're seeing, in the world, and we're going to focus on rapidly kind of going through this process. And I will say in no short words, rapid innovation was not the strong suit of this industry. I don't think that's a surprise to people. I think that if you looked at the way something like telehealth, for instance, if you look at the way that we were talking to customers around telehealth, telehealth was a program that was going to be somewhere between 6 months and 2 years for people to roll out a solution and be able to train their staff and get ready to truly use this. As we saw, ultimately we had 5 or 6 days. And so people had to get into this rapid iteration mode of, we have these problem sets, we need to try things quickly. How can we do so where there's the least amount of risk, yet we can start to realize some of the value that's ultimately coming out of these things. So we had, for us, we had new product categories that appeared overnight. We went from basically not doing nothing with PPE to PPE being, our customers ultimately asking us to set up a PPE supply chain. And so we had to go form these relationships and figure out, we can't get gloves and gowns and masks through traditional mechanisms. Everybody's sold out, everything's being shifted to acute. So we started to focus on, all right, immediate need. How can we start to provide some of this equipment that is basically just unavailable at this point? And then we started focusing on infection control. We said, all right, we're taking care of the caregivers now. Now, how do we focus on infection control? Because, even to today, we're still learning more about how the virus transmits. I think if we think about when this first started, we had people who were bleach wiping their boxes of cereal because what we thought at the time was that, major transmission is happening through touch. So doorknobs and packaged goods and things like that. Well, we had to start thinking through, all right, if touch is the issue, how do we mitigate that? So what are the cleaning practices we have to look at? What do we do there? As Liz talked about, we think about isolation units and how do we isolate people from, the sick from the healthy. And these were not things that this industry was used to. We started thinking about employee and visitor screening. Visitor screening is still somewhat of a question mark because really we're not allowing visitors to come in a whole lot right now. But employees, we were able to control the activities that were happening for employees within the walls of the facility. But as soon as that person leaves, they're going to the grocery store, they're getting Uber Eats delivered, they're having all these other things. And so what does screening look like to try to do our best to ensure that we're not bringing this into our building? And then environmental pieces. So as we learn more about the air quality side, as we learned more about how this virus could be aerosolized and transmitted that way. And then obviously the big one was the kind of physical and emotional isolation of residents. So I think, everybody's heartstrings were probably tugged at pretty hard watching news coverage of people sitting outside of the window, of the facility and having communications with their loved one, or the people that was eliminated completely. So all of these new areas that we really started looking into to understand, how can we go out and help to move this forward. So I'm going to touch on some of those. I'm going to touch on some that are things that we put in place as a response. And I'm going to talk about some things that we're looking towards the future in, and give you an idea of how we're looking at some of these solutions and how they'll actually affect us in the future. So this is where it all started. This whole idea of innovate from everywhere. This picture is me in my basement with all of my random stuff hanging on the wall. But ultimately, we were looking at stuff around. We had customers coming to say, we can't get gowns. We have to figure out how we can reuse gowns. What can we do? Can we, we can't necessarily wash them because they're going to fall apart. Can we spray them down with something? What type of sprayers work better? What type of chemicals can we use? And there were shortages on everything. So, this was ultimately me going to Home Depot and figuring out that the closest thing to an electrostatic sprayer that was readily available was ultimately a Wagner stain sprayer. And so this was testing things out, in the basement, trying to come back and provide some options for people because, the supply chain was attempting to catch up. But this whole idea of, anything that we can do to help move this thing forward is what we're willing to do, even if it's non-traditional. And I think the non-traditional piece is something that we really try to focus attention on, because so many people and so many of us in general get caught up in this is the traditional way of doing something. This is the way it's always been done, and this is the way it's likely going to be done for the foreseeable future. So getting yourself outside of those boundaries and saying, all right, what is the problem I'm trying to solve? All right, the problem is this. Great. What are the tools that I have at my disposal, regardless of whether they're traditional or not, that I can use to help solve that? And so there's a lot of stuff that we look at from a startup standpoint or anything else that are solutions that weren't actually made. They certainly weren't made for senior health, and some of them weren't made for health at all. But they ultimately solve a problem set that the inventors weren't even thinking of. And so we'll work with those groups to refine those ideas and kind of push them forward. And there's some amazing things that have ended up having huge impacts to senior living overall that came from totally other industries. So one example is really the kind of visitor and staff screening side. So as we started thinking about opening our buildings back up, and even as we thought about employees coming in, this ability to screen staff was something that became kind of a high hitter on the list. And so we started looking at solutions that were there. And really a lot of these solutions were ultimately coming from overseas, really for the reason that Asia and the South Pacific, they had dealt with SARS and MRSA and others in previous years. And so if you think about even news coverage of people walking through an airport or anything else, if you think about having seen those in Asia anytime over the last few years, there's probably a lot of people wearing masks. And a lot of technology was going into how can we not, transmit disease. So this is something that we looked at, and it really kind of had two different form factors. One being, a kind of kiosk style solution that I could walk up to. It would take my temperature, can ask some screening questions, and ultimately say, give me a digital trail to say that, yep, someone has gone through the process. As best we can identify carriers, and obviously we have asymptomatic carriers, which is kind of its own issue. But as best as we can identify people, we're going to ask them to isolate. We're going to ask them not to come into our walls. We don't want to give an opportunity there. So, on the left is kind of a kiosk style. On the right is more of a security camera style, where if you have, I won't say a mass of people because that's probably not pretty accurate for us. But if you think about employees, you have employees coming in and they're all coming in around the same time. Instead of doing individual checks on each one, you may go this path of saying, well, I want to see the outliers in that population. So I can see if there's 5 people coming in, who is an outlier within that from a temperature perspective. So this is something we're seeing kind of more and more of out there, and I think we're going to see it across all sorts of industries. To Liz's point, we started thinking about indoor air quality and just the environment itself. So this whole idea, and this is a horrible acronym and even worse to actually talk about, but needlepoint bipolar ionization is the technology. But ultimately, this is something that we were looking at 1.5 to 2 years ago, and we were looking at it for energy savings. The whole idea behind the system was you can limit the amount of outside air that you need to bring into your facility because you're treating it with this ionization process that ultimately is removing particulate. It's attacking odors and other things in the air. And so we originally looked at it because at that time, people weren't making decisions and investment decisions based off of infection control. They were making investment decisions based off of cost savings. And so we always knew there was an infection control component here, but then when COVID hit, all of a sudden this whole product line kind of flipped over, and it was yeah, we can save energy, but the big thing we can actually do is we can focus on air quality. When we knew that COVID could be aerosolized and that that's one of the ways that transmission was happening, we started working on the testing of this. And so ultimately, this was something that already had data against, the coronavirus kind of macro category, but we were able to actually go out and test specifically against the SARS-CoV-2, and we're able to find that basically this technology is able to inactivate 99.4% of SARS-CoV-2 within the air within about 30 minutes. And, as I'm sure a lot of you have heard about, UV usage and cleaning products and everything else, this is something that really works around the clock. So anytime air is moving within your facility, this system is on and this system is actually treating the air. This is something we've actually, the office that I'm in right now, in an attempt to dog food our own products, this is something that we put in all of our own offices because our offices stayed open this entire time and we had people coming in and out, and we believed in the science here and said, all right, well, we're going to put it in our own offices. And so we're seeing this become kind of a new standard as folks are thinking about, especially for new builds, but even for renovations and things that can be put in, right now, kind of after the fact. So another one that's super interesting when we think about the kind of immediate need and how we can offset some of these risks. So looking to the future, now we have to think about this whole idea of and I hate the term, but the new normal. I've heard people say a post-COVID world, or maybe it's just a COVID world where this is something that we have to be aware of, and whether it's COVID-19 or COVID-20 or COVID-21 or whatever, we have to keep our kind of wits about us, and we have to be prepared to identify quickly and respond quickly when something like this, appears at our doorstep. And so this is always a favorite one because who doesn't like talking about toilets? But waste analysis is one of the things that we're looking at. And, this is an example of something that is, it's doing an optical scan of toilet contents. And now I will ask that you all let the weird out moment of there's a camera in my toilet pass for just a second as we walk through this. But the whole thought here is that how can you use smart technology, and whether it's cameras or sensors or other things, to start identifying issues that may be happening with someone immediately? And so if you think about how hands-on this process is today, of maybe it's the hat in the toilet and someone has to go and examine after the fact, how can you put something in place where someone can really go about their normal business and the environment around them is going to understand what's happening there? And so this is an example where things like dehydration, urinary tract infections, IBS, other things could be identified very early And you don't need a person to kind of interact with the system at that point. The other side of this, and one of the things that we're looking for, really kind of in the future, is this whole idea of just wastewater epidemiology. And so if you think about it from the standpoint of today, and maybe, the past few months, the only way to know that someone within the building had this infection was ultimately to test them. And you had to find symptoms up front, you had to identify them as a candidate, and then test them, and then wait, however long to get those results back. This is the whole idea that, if you had sensors within even the kind of sewage pipes within a building, you could start identifying the shed RNA of these viruses early on and say, listen, someone in the building has this. And you could get all the way down to someone in this wing or someone in this room. But the whole idea of, if you can identify that right away, you can start looking at isolation and all these other things to prevent spread within the community. So this one is super early, but it's a very interesting thing to think about, of how we would identify even earlier in the process. Passive monitoring, this is certainly an interesting one as we think about the interaction that we've had with residents has changed, and how we're moving staff around the building, or hopefully not moving staff around the building. But how can I know that people are doing well when I'm not having as much face-to-face interaction with them as I maybe once did? And so this is a solution that really focuses on the radar side of things. So there's a component that basically can sit in the ceiling. It's sending a signal out, and it's reading back information about what's happening within that space. So movement, I can know where someone is, how often they're moving, things like that. But it's actually so precise that it can measure heart rate and breathing rate for someone who's relatively still. So let's say they're sitting in a chair or they're lying in bed. I can know that that person is in their room. I can know that they're in bed, and I can know that their breathing rate is fine and their heart rate is fine. So maybe I can let them sleep. Maybe I'm not going to send someone in there right now because they need the rest. So this whole passive monitoring approach is something that's super interesting from our standpoint, and as someone who's been in kind of healthcare my whole career, from a technology side, the technology is amazing. Now, this is the one that's even more amazing in my eyes, and Liz and I were talking about it the other day, and she asked me, how does this thing work? And my honest answer was, I know a little bit, but there's a lot happening behind the scenes that I don't know yet. But this is ultimately a system that's using cameras to ultimately pull vitals from slight color deviations in the face. So it's using a camera, and it's using the red, yellow, and green spectrums, and it's measuring slight pulses in veins in the head and other things. And it's actually able to pull this data like heart rate, oxygen saturation, respiration, heart rate variability. Eventually, they think they're going to be able to do blood pressure. They're doing this completely passively with just the camera. And it's literally a cell phone camera or a tablet camera. It doesn't need to be anything that's too crazy. And so ultimately, this is just crazy signal processing behind the scenes. And so if you think about the ability to build this into a bathroom mirror or other things, or just have it a tablet mounted on the wall and be able to have someone come up, sit in front of it for a minute or two, and pull all of this information in. This is something that is insane in my mind, and I'm really hoping that this comes to fruition. We actually have a pilot of it running here, and it seems pretty accurate compared to my my Apple Watch that's doing a bunch of the same things. So there's some cool technology that's coming through that I think we're going to see more and more of as we think about how we're going to ultimately care for residents in the future. Mm-hmm. So that was kind of the fastest push through healthcare technology, but hopefully it gives you some things to think about in terms of what are some of the things that are kind of coming down the pipe, and how can we think about caring for people in a different way, and what information will we ultimately want. So, I think that's something that Liz and I are always open to, is starting to understand, what would you do if you had this information? How would you respond? How would it change the way you deliver care? How would it change the way you ultimately build a new facility if you were treating people in a very different way? So I'd say thank you for the time, and we're going to talk through some kind of takeaways that we hope the group can kind of run with now.
Yeah, Justin, as we move to this next slide here, you know, every time I see that that facial recognition, I just think, wow, like how far we've come in just such a short amount of time. I was recounting yesterday to someone that my very first job, you know, it was during a period of time when we were, you know, we had fax machines and we weren't using computers, and to go from that, even in the span of one person, you know, one career really, that we're, you know, is so rapidly expanding so quickly. So, you know, I think that one of the things I did want to share as well is that as this new tech is being developed, it really becomes so critical for these developers to have insights from the people who actually are using it. And that's really something that we try to make happen as much as we can. And that's where many of you that might be on the webinar today have participated in some of those sessions with us in the past. Those are so critical because sometimes this technology gets developed with the masses in mind. Masses meaning people that are, you know, Justin's age, you know, the young whippersnappers that are like Justin's age, or with children, and they're not thinking about designing for an older adult, or for some of the biological changes and the physiological changes that occur with an older adult. And so that's where, you know, we're always trying to like marry those things together so that as they've got that right mindset, if they're trying to solve a problem for an older adult, that they know how to solve for it. So I just wanted to share that because I think that's, you could go to CES, you could go to these different shows and you see people that are just these beautiful brains that are building all this really cool stuff. But it really has to work for the people that we're looking for it to work for.
Yeah, and I think that's where I'll put in the subtle plug for our technology center is that's really what our focus is. And you know, once things get back to some semblance of normal and travel is safe again and things like that, you know, and even before that, hopping on a call or doing a video call or things like that, you know, those are the questions and those are the things that we really want to work on with our customers. So like I said kind of early on, if you have problem sets or if you have technology that you're really interested in, but you're not sure how it's going to fit in, you know, I know a lot of our customers have technology groups that are kind of pounding on the front door of, you know, we've got the next greatest solution to XYZ, and you don't really know what to do next. And so that's really where, you know, we're trying to kind of give some insights. And so, you know, the takeaways piece is really pretty simple. You know, one, if you don't have a method to take those things on and you don't have a process identified internally, now is really the time to think about it. The silver lining to everything that's happening right now is there is going to be a push on innovation and technology within this industry. Both to protect residents and caregivers within the industry, as well as coming out of this, you know, people are going to have questions around living in congregate care, and we can't abide by the old models anymore. You know, we're going to have to make congregate care more attractive to people. We're going to have to focus on how we get people into the buildings, how we take care of them, and how we bring this quality of life that they're going to be used to outside these walls. So anything that we can help there, I mean, certainly, you know, let us know. And I think really that kind of spoke to the second one. And the final part is really the don't do it alone. Whether you're collaborating with us, collaborating with others within your organization, or collaborating through public organizations, you know, communication is huge. And I think, you know, I'll speak for my side, and I know that Liz has seen it as well. The cross communication between different companies working in the same space during the past handful of months has been amazing in my mind. The willingness for people to communicate, here's what we're dealing with, here's what we're trying, here's what works, here's what doesn't work. Everybody is pushing for the betterment of the industry. And there's certainly a hope that that is going to continue in a big way as we move forward. So, find those people that you can bounce ideas off of, find those people that you can ask questions of, and use them as a sounding board to bring new things into your organization, to try new things. Not everything's going to work, but if you try it, you'll understand, well, here's what I should have been looking for, or here's where the downside was. You're going to know that for the next one.
And I'll just, share here. I think, in the middle of everything that, if you're a provider, in the middle of everything that you're dealing with right now, perhaps the last thing that you're thinking about is how do we put some time and effort into innovation? And, the reality is that you are already, and you've been innovating. That's very much the nature of working in this sector, is the need to be able to do more with less. And so if we can leave you with one final thought before we go to questions, is that, know that you're not alone, and that if there are things that we can help with, please reach out. And we, even if it's to be able to introduce you to some other provider that's working on the same problem that you're working on, or has a different idea that maybe they've come up with that they're giving a try. We don't want you to feel alone, and you're not alone. There's a lot of folks that are working on a lot of the same things. So please reach out and let us help you if we can. So with that, Megan, I think we'll go over to see if we have any questions.
Yeah, yep, absolutely. So I'll start by just saying thank you both for that really awesome presentation. I think I took a couple of notes for follow-up questions to ask as well. We had a lot of interest around the discussion of passive monitoring. Is there any level of prediction around when that's going to be available for use within industry care programs and more on a mainstream scale?
Yep. Yeah, so I think the easy answer is we're seeing pieces of it today. And so you can think about wearables as kind of the first generation of passive monitoring, right? So, a lot of us have smartwatches on and things like that. We're seeing the wearables be kind of the first generation of this, of where someone can wear it around all day long. It's kind of continuously gathering information. My guess is in the next probably 2 years, we'll see some of those that don't require wearables at all. We're going to start to see solutions that are built into the ceiling and the walls and other places and able to, connect that information. The downside of it right now is a wearable is very easy to track to a person. I know it's on me. I know it's my information. When you have it just built into the environment, you have to be able to tell the difference between a resident is in that room and a caregiver is in that room. And so those are some of the things that we're working through right now, but I think we'll be getting there in the next couple of years here.
Awesome. The next set of questions that we had kind of revolved around, so getting new technology is cool, having new technology is great, training on that technology can be exciting, but ultimately the idea of making that technology stick in your building, in your facility, in your resident room can be tough. Do you have any advice on how to help ease that?
Mm-hmm. Yeah, good question, and a lot in that question there, right? I think that the point I made earlier around the design of some of the things, I think about some of the early days of electronic health record implementation. And back when we were, in many ways it was, the very first electronic health records were very MDS focused. They were very job oriented. They were very focused on getting us from A to Z. And today now we've continued to see electronic health records, bloom into these more multidimensional, multifunctional kinds of platforms that allow for people to do more with them. And I think the stickiness comes from when people really understand how the system can give them what it is that they need to get their job done. And so I think from time to time, it's important to kind of go back and reflect on what you're getting from your existing system today, and are you really getting the maximum benefit from it? sometimes we see a lot of staff turnover, a lot of staff movement that occurs, right? You might have a DON in one building that leaves and goes to another building. And in one building, she was using reports, and the other building wasn't using those reports. And so sometimes that cross-pollination of knowledge and skill starts to naturally disseminate just because of turnover anyway. But I do think it's worth taking the time to go back and really look at what are the upgrades that people have made. How can we make sure that we're maximizing the investment we've already made? And then, you know, inviting new staff members to learn the system and to figure out how they're finding value in it and how they can share it with others too. So it really is that you've got to think about that human connection and the kind of value in what they're using the information for.
So thanks again, everyone, and a big thank you to everyone for your time and questions. Now, for anyone who is interested in learning about how direct supply can help you navigate these new technologies and products, please help me welcome Vince Gerbec.
Hi, everybody, and thanks, Megan. Justin and Liz, thanks so much. Love Justin talking about what's next, but we do have some products that are here and ready now. What gets me most excited about some of the products is really focused on quality of life of our residents and or the caregiver experience. So the first one I just wanted to kick off with was Safely You. So Justin, if you can flip the slide. So Safely You is a falls prevention technology that we're seeing in our communities today. And what really gets me excited about is the results. So they've had a reduction in falls with their customers and our customers by 40%. And then a reduction in ER visits by between 70 to 80%. So real quantitative figures to help our aging population. So just basically how it works is cameras installed in the room. It's an opt-in by the resident or the adult child. And then what it does is that camera actually is equipped with AI technology that can alert if a fall happens within a room. And what's really cool about it is actually what happens after. So once a fall does happen, an alert goes out to your staff, and you can set up those alerts in any way that you want, and have escalations along with it. So as the fall happens, caregivers can respond quickly. And what it does is actually only records the 10 minutes before so they can see why the fall occurred and how it occurred. And then 10 minutes after as well to assess how the caregivers took care of the resident and followed proper procedure too. And so once the fall takes place and the caregivers respond, what's really nice is that they have a team of experts that have now experienced over 8,000 falls within communities on their platform. That'll go through, they'll help with documentation for your staff, and then they'll also do some coaching. So as simple as, was a TV in optimal position? Is that why the resident fell to the ground? Or a real life, one of our examples is with a current customer that we have, and this story really stood out to me. There was a memory care resident that continued to lower herself to the floor at 7 a.m. Quite frequently. Since she was a memory care resident, she was actually unable to really articulate how she was going to the floor. And they didn't notice any bruising or anything, but they didn't know what was happening. So once they implemented this technology, though, they just saw that she was lowering herself to the floor, but she was trying to go to the restroom, and she was just trying to go at 7 a.m. And the care plan called for a wake up around 8 a.m. So a simple change in that care plan resulted in obviously a safer resident experience, a happier family because they were able to communicate what they identified with the technology, and then also no need for an ER visit. So we start talking about safety. The safest place for our residents today is communities. And so the need to not actually send somebody out with an ER visit because we didn't witness the fall happening has been a huge savior to our communities in this tough time. Justin, if you want to flip to the next slide. Just taking you through the actual technology of what it looks like. You'll see in slide number, or picture number 1, the green, it is nobody is on the floor. As soon as somebody is to the floor, it goes into red, and that's when that alert actually happens. and the alert goes out, staff goes and helps with the resident. And then on the back end, as you notice there, with the documentation and the falls review with the team. So really making it a more pleasant experience and one of the worst experiences that a resident or a caregiver can go through. The next technology. Oh, I'm sorry. I mentioned on the front end, but the actual results that we see. The 40% reduction in falls, 70% to 80% even now reduction in the ER visits from the falls too. So real results, and when we start talking about quality of life for resident, we know that's so important. But also from a financial side of things, with falls that start, a claim can be anywhere from $1 million or more. Keeping the resident safe and identifying what happened with the fall is key. So the next technology is Centrac, and this is really just the power of real-time location. This technology has been used in the acute care space for years, but now it's finally been brought to senior living at a price point that fits our market. So on its base, it can serve as your typical nurse call system, but it does so much more. So it can, just like a typical nurse call system, if you click on a pendant or a pull cord, it'll alert the staff. But what it also does is the real-time locating. So as simple as if I come in to see my mom in a community and I walk in and she's not in her room, I can go to the staff and say, hey, do you know where she's at? She might be in the dining hall or in a courtyard. It also handles wander management really well. So you can set up safe zones within a community too. So as soon as, say, a resident maybe wanders into a kitchen or into a room that they shouldn't be in, it can send out alerts. Or even you can set up times so if a resident is in the room for too long or is in the restroom for an hour, it has the ability to alert you at those times. So it's tracking them without actually having to press a button or pull on a pull cord. Another great piece is the contact tracing. So obviously with COVID happening right now, and similar to when the Ebola outbreak happened in 2014, if you remember, in the hospitals, this was the actual technology Centrac that was utilized to track where the virus was spreading. So for example, with COVID, if you notice that a resident tests positive, you can look back on the history of that resident, who they interacted with, where they were within the community, and then you can start identifying the people that you need to possibly test first. And then also, if you go to the next slide here, Justin. Also, what Centrac allows you to do too is put a wearable onto your staff. And so if your staff's has the wearable on, you can track ADLs and how long they're spending with residents and identify if you maybe need to make a change to their care plan or discuss with family the reasons why that your staff is spending so much time with the resident, or to show that they are spending time with your residents as well. So that real-time technology that's passively tracking both staff and your residents within a community is an absolute next step in the world of nurse call and so much more. Go ahead, Justin. And then the final piece, which you might be familiar with if you've attended some of these in the past, but is DS Smart. So really focused on making life for your caregivers better. So how DS Smart works is it can hook up to a weight or a scale, a vital sign monitor, and then even what was really nice is that we were able to pivot very quickly with what's going on with COVID to introduce a handheld thermometer. And the handheld thermometer can connect directly to the DS Smart application via Bluetooth, as well as all those other, the VSM and the scale. And then it actually pushes into the DS Smart app. And then what it does is with the click of a button, it actually sends out those vitals that were just taken directly into your EHR system. And so another great piece of this for staff is that they don't need to have any duplicate entry. They don't write it down on a piece of paper. I know if I'm having to pass along a note of some vitals down to somebody that's going to enter into PCC, good luck with my handwriting. But What this does is it allows for that information to flow quickly into the EHR, and it can even have an integration. You'll notice the integration goes both ways. So if you do set any thresholds in there, so as we start taking temperatures more often, if I have an elevated temperature over a certain threshold that you set, it'll actually alert you and say, this person has a temperature of 101. And then you'll be able to actually see that in real time and take action on it, as well as like if it's hooked up to a scale. If they are weighed and maybe there's a 10% increase or decrease from the last time that a resident was weighed, it's going to alert you on that as well. So it helps with the technology and making it smart and easy for caregivers to identify if there are any inconsistencies, but ultimately just save time. And so, Justin, if you move over to the next slide, the outcomes that we've seen with our customers over the last few years are obviously time saving. So when care staff is using this with their residents, they're seeing about a minute per vital take and save. And that's over years of use in communities that we track. Also clinical data accuracy. So without the possibility of maybe typing something wrong into the point-click care system or the Matrix Care or NetSmart, the EHR system, it's going to be accurate because it's taking it directly from the VSM or the device and putting it directly into your EHR system. And then obviously with the improved clinical outcomes, I think now more than ever, we're focused on our resident care. And so, for example, like I mentioned before, when a temperature is escalated or is too high or too low, it's going to send those alerts so you can take quick action to a resident that might have a vital that's a little bit not normal. But ultimately, as with any technology in our space and in senior living, I think it came up with Megan earlier, but it needs to be easy to use too. I mean, there's definitely a workforce shortage, and there's definitely high turnover rates within our industry today. So it needs to be a technology that's easy to use. So that was the ultimate platform that DS Smart is it's easy to implement and succeed with along the way. So happy to share some of those. If there are any questions, I know Megan's going to send out my contact information after. Would love to take you through some of these, talk in more detail. But thank you everybody for your time.
Awesome. Thank you so much, Vince. So just one more time, thank you to everybody who took the time to join us for today's webinar. Have a great day.